A seemingly limitless scrub waste without landmarks or water or other relief, dry and monotonous. The heat is unforgiving, but he walks in it like the hero he is perceived as in this village. A village where for many people a task as easy and effortless as a blink of an eye is so laborious and painful.
I'm Dr. Hilary Rono. I'm an ophthalmologist based in Kitale Hospital, but I do coordinate eye services in Trans Nzoia, West Pokot, and Turkana counties. I've been an ophthalmologist in this region now for 10 years. After finishing my school, I asked to be posted to this region, and most guys thought I was crazy because nobody wanted to be in this area, but I said, hey, let me start, and that's why I'm here.
For a decade, he has dedicated his life to serving the people of these three areas who have a number of medical needs but very few professionals to serve them. He has helped restore eyesight to hundreds of people, perhaps more than any doctor in Kenya, and still his patients come. They sit in remote villages, and since they cannot come to him, he has to find his way to them. If he waits at the hospital, none of them will show up.
One of the biggest challenges that we have in Turkana is distance. We've traveled a longer distance to find patients, and as we've used vehicles, we are very tired. You can imagine what it would be for the patients who are blind, walking through shrubs, traveling up to 30 kilometers to the nearest health facility to actually get eye services. It's a real burden. It's a big problem for them, and we have to do something. We have to find them, take them, and give them the best service within the shortest time possible for us.
Until 2 years ago, William Lokolong spent every year of his adult life carving out this multi-purpose seat used by Turkana men. It is used as a pillow and also by tired herders when looking after cattle. When Dr. Rono met him, he was almost going blind from trachoma. Dr. Rono tells me every village in Turkana County has a handful or more of persons suffering from trachoma, and one or two who are already blind from it. His mission is to help end trachoma in this region, and anytime a community health worker tells him of a suspected trachoma patient, he makes his way to them.
I thought we were coming to see one patient who we had successfully done surgery today. But in this village, we have seen 1, 2, 3, 5 patients already who have eye problems. They are actually blind in one eye, and one is almost going blind in both eyes. So there is a big problem of blindness in this village, and we have to do something about it.
Watu mingi. Kui watu mingi na shida macho. Na shida macho.
Iko wale wamekuwa kipofu kabisa waoni?
Iko. Kwa hata hiyo. Hata mama ile mimi namwambia nyinyi hapa. Hapa naona.
One of the risk factors for trachoma is hot, dry environment with no water and poor personal hygiene. Among the Turkana and many other pastoralist groups, there is a close relationship between people and their animals. Some people even share sleeping quarters with their animals to ensure they are secure. Cow dung is a breeding ground for flies that transmit trachoma called musasobens.
With the way of life with our people, they live with the animals, they sleep with the animals, they walk with the animals, they move around the animals. The cow dung, the milk attract the house flies. They don't have toilets, they don't have water. So wash of the face is just a story. They wash face when they have a lot of water. the first thing they have for their water is for animals. And they believe that if the animal is okay, even them, they are okay.
In affected communities, infection is often first encountered in infancy or childhood and recurs over many years. The cumulative effect of many inflammatory episodes may cause the upper eyelid to turn inwards so that the eyelashes rub on the eyeball, resulting in intense pain and scarring of the front of the eye. This is called trachomatous trichiasis and ultimately leads to irreversible blindness.
There are 4 stages of trachoma. There is the active stage, which is commonly found in children, what we were seeing today. Then we have stage 2, which is active trachoma plus inflammations in the eyes. Then we have stage 3, where the lashes, because of the intense inflammations in the lids, the eyelid turns inwards and the lashes rubs on the clear part of the cornea. You can see in Asenyen's right eye, all the lashes have turned inwards and they are rubbing on the eye. It's really painful, and that is stage 3. If you look at the clear part of the eye, that is supposed to be the black part of the eye, is beginning to be white. That's the early part of stage 4, which we are beginning to get a corneal scar, and that is, she's beginning to be blind from trachoma.
A World Health Organization survey done in 2013 cites blinding trachoma as endemic in many of the poorest and most remote areas of 51 countries in Africa, Asia, Central and South America, Australia and the Middle East. Worldwide, an estimated 2.2 million people are visually impaired as a result of trachoma, of which 1.2 million are blind. Africa is the worst affected continent. 18 million cases of active trachoma, that is 85% of all cases globally, and 3.2 million cases of trichiasis are thought to exist in 29 of the 47 countries in WHO's African region. Ethiopia and South Sudan have the highest prevalence of active trachoma. In some areas of these countries, active disease is present in more than 50% of children aged 1 to 9 years, and trichiasis affects more than 10% of adults. Closer home, trachoma is endemic in 12 of the country's 47 counties, concentrated in the highly disadvantaged regions of northern Kenya and the country's border with South Sudan, Ethiopia and Uganda. These areas have no public transport system and poor quality roads, and as a result are frequently inaccessible. At the same time, people in these regions are either too poor to afford treatment or do not think they need treatment.
Sauti yake nilikuwa sijui kama nikabila gani, lakini nasikia tu sauti.
At the end of each day, he has touched tens of pairs of eyes and knocked dozens of doors. From Turkana County, Dr. Rono and his team have to make another routine journey to West Pokot County. The drill is the same. The doctors have to go to the people. Today, Dr. Rono has commissioned a second ophthalmologist to help him in West Pokot, as he has a number of patients and surgeries to conduct in Turkana County.
West Pokot is a diverse county. It's a very vast county. The county is trying to upgrade the roads, but they are not up to scale. So traveling becomes very hard for us. All the way from Kapenguria to the farthest corners of the county, it can be very hard. Even for the patients to get to the facilities, it's very hard. So it calls for sacrifice from the entire team.
A vehicle with medical staff and basic screening equipment travels to rural villages where clinics have previously been scheduled. Here, the only way they can get these people is to target specific days like market days. This is the only day everybody rests and they all converge at the marketplace. On any other day, the team will not find any of these people at home, as most go to herd their cattle.
It's tricky. It's a process. Okay. First of all, you go to places and there's resistance. But then after they see that more often than not, you get 1 or 2 people who are willing to be done surgery even on day 1. So you do a good job on day 1 or day 2, then you use this as advocate. When they go back to the community and the community sees that they have improved in vision or that they are now comfortable, they spread the gospel, and by the second day, the third day, they come in droves now.
Ortum Market in Kapenguria is their destination today. The shade of this tree provides an office and testing center. The goal is to find candidates for the trachoma surgery procedure among hundreds who are screened. A good number come holding onto their walking sticks, not because of old age, but because they cannot see. Most are those who have heard or seen their neighbors getting treated and getting relief from the pain caused by the lashes touching their cornea. Some of those who come today have cataracts too, a blinding eye illness. Many have lost their sight, and even though the doctors are looking for trachoma patients, they cannot send away those with cataracts. Doing this may send a negative impression and cause resistance, since the people do not really know the difference between the two eye diseases. In about an hour, the doctors have identified more than 10 patients who are almost going blind, and a few others who are already blind from trachoma and cataract. They all need surgery. Those selected for the surgery are transported to a local hospital in this double-cabin vehicle. The nearest health center is 50 kilometers away at Chepkobe. A 2-hour journey of easing over humps and trenches, potholes and stone rivers, bashing through trees and flat, wide open land. The age at which people in a community start going blind from trachoma is related to the intensity of transmission of infection in the community. Women suffer much more often and severely from trachoma than men. This is because women usually care for young children and end up being exposed to reinfections from infected children. If left untreated, the infection persists and the scarring worsens over the years until it's too late and blindness is irreversible. In a desperate attempt to alleviate the pain of trachoma, many people resort to pulling out their eyelashes.
It is like when you are driving a car in a rainy day and your wipers are worn out. They are actually scratching the windscreen. That's how exactly a patient feels, that scratching of the windscreen. And the marks it leaves is the marks that the lashes leaves on the cornea of the eye. And if you can imagine how the marks left in the windscreen of a car and translate that to the eye, it's really painful, and it's a kind of painful blindness that nobody should actually go through.
This room at the Chepkobe Health Center has been converted into a theater. 67-year-old Cheparkong Arumoreng, one of the women found at Ortum Market, is among those with advanced trachoma.
So when you do one eye, they will not even prefer to come again.
Limangole Loriono, a clinical officer for many decades, will be the one to perform a surgery on her.
This is a patient who was coming to the market, but when one of us got her and saw that she was having mini trachoma, she was referred to where we were screening patient. So we saw that at least the patient was having trachoma. We convinced her to come for the operation here at Chepkope, which is free, and she accepted. This patient has been having with this problem for about 15 years. These are the patients who will not respond on treatment like antibiotic, or fresh washing, or environment. Because to control trachoma or to eliminate trachoma, we have to do 4 things. That is surgery, like the way we are doing here. That's the first thing. These are because you cannot do anything with this in turning of eyelashes.
The strategy also includes mass drug administration of antibiotics to treat infections, facial cleanliness and environmental improvement, particularly improving access to water and sanitation. The surgery takes about 5 to 10 minutes. Normally, it would cost between 2,000 and 4,000 shillings.
We are doing this operation to elevate the pains and to prevent blindness. So now we don't want this patient to get corneal scar, which will make her to be blind later on.
Akudu Chukuna from Subukwo is 70 years old. He is Limangole's next patient. Akudu has only one eye as he lost the other one through an illness he does not clearly remember. For 20 years, he has suffered from trachoma in his remaining eye. He was spotted at Ortum Market today, walking with the aid of a stick. Upon examination, though, the doctors realized his other eye has already been permanently damaged from trachoma. He is now totally blind.
Now what has caused the in-turning of the eyelashes and blindness? It's the last stage of trachoma. We call it a trachoma scar. So we are only doing the operation, not for him to see, but for him not to have pain and at least relax. Yeah, I have explained it to him and he has accepted, because that pain is so severe and he doesn't have money to come to Kapenguni.
Culture and beliefs surrounding trachoma in these regions are some of the factors contributing to such cases, where people suffer silently for years, and for some, the problem is realized when it is already too late to save their eyesight.
Just do the right eye.
Among these communities, it is believed that the more the number of flies perched on one's face, the wealthier he or she will be.
In West Pokot, for example, when a child plucks lashes from the grandparents, because that's the population that have the lashes, it is thought or is believed that they confer blessings to the children. Now here I come as a doctor, I want to operate that person, which means I'm denying blessings for the children. So there's a big conflict now within modern medicine and the cultural medicine.
Turkana culturally, they know this disease as Lokir or Lope. Lope in the sense that it is a disease that was brought to Pokots to them. Those who went to raid Pokots got it from there. And maybe along River Takwel, where the river flows from West Pokot to Turkana, they believe also that river carried the disease to them. So whenever they have this disease, they always use herbs called esekon. They also use roots, arrow roots, to treat the disease. Where the trachoma has become a blinding one, they have trachoma trichiasis. They use a leaf of a tree called ebenyo to cut the eye, and then it bleeds. It heals by scarring.
Beyond the disability, distress, isolation and stigma that it causes, the economic burden of trachoma on affected individuals and communities is enormous, costing between 290 to 500 billion shillings annually, increasing to 800 billion when trichiasis is included. At about 4,000 shillings per surgery, preventing this economic disaster is very affordable. In Kenya, the campaign to end trachoma is being spearheaded in part by the Fred Hollows Foundation. In partnership with the government, its aim is to strengthen the eye health workforce through, among other things, necessitating training of ophthalmologists and mid-level surgeons to clear the backlog of people needing surgery.
Now they are putting a lot of structures in the county.
Through the partnership, this surgery is offered free of charge.
We support Ministry of Health to implement eye care services, including trachoma control activities. We also support Ministry of Health in terms of human resource development. We support them in terms of trainings. We also support provision of equipment for eye care services, and we also support community sensitization activities.
More than 20 surgeries later for trachoma cases and a few cataract cases, it is time to call it a day at Chepkobe. Following the surgery, patients are kept for a day for post-operative care and observation before they are allowed to return to their homes. These patients stay at the hospital overnight. Blindness is both extremely debilitating and often easy to overcome or prevent. Blinding trachoma can be prevented with improved hygiene and appropriate use of antibiotics, and cataracts can be treated with surgery. A day after the surgery, Cheparkong Arumuring and Akudu Chukuna, together with 23 other patients, are ready to have their bandages removed. Medics carefully pull off their eye patches. They blink a couple of times and take in their surroundings for the first time in years.
Because for us we are used to it. Like
Ya naona watu. Nani?
Anaona watu huku, anaona huku
Imekuwa mzuri.
Ne wada?
Hapo mbele alikuwa ni hata kitu hapo karibu. Hata akifanya hivi alikuwa.
Sasa lagi sawa yenyewe. Tuliwaona rela.
Sasa anaona sasa mtu.
Hao mbele kana.
Sasa anaona huyu anangonyo.
Naona sasa huko. Mimi naona watu tu. Nilikuwa mimi hapana wananga watu ati ilikuwa namna gani hata wale wako paranda huko. Sasa mimi naona kabisa. Naona nini? Naona wako na kikapu yao wakina mama wale. Mimi naona kabisa. Nilikuwa mimi hapana wananga kila siku. Ndio mimi naona leo.
When the retests are done, they signal with authority. And they come out with excellent results.
Well, at the end of the week, you are tired, but there's always an overriding feeling to that, which is joy that fills your heart. When someone comes to a camp like this, they have problems, maybe their eyes are painful and tearing, and if you do trachoma surgery and the following day they are comfortable, you are very happy. Or they come, they are blind, they are held in tow by their small grandchildren or their relative, and the following day they are able to see, they even forget their sticks, they forget where the grandchildren are anymore, and they are happy and they can see. That brings a lot of joy. I don't think you can get a better reward than that.
They have no money to give, but a song of gratitude. Whose words send the doctors away with blessings. It is the end of a long journey of pain and discomfort, and literally the beginning of a new life for these men and women. Some who say they have grandchildren but do not know how they look like, because the only motion they could capture is a wave of the hand directly in front of their faces. Medics and stakeholders in the campaign to end trachoma hope that in the next 3 years they will not be holding such camps, and that children in these regions will grow up trachoma free. And when the time comes for them to start the bumpy ride back to the market where they were picked up from, some walking sticks remain on the veranda, abandoned by their owners. Who needs a stick when they can now see perfectly well? Mercy Juma Okande, NTV in West Pokot County.